Hi doctor,
How are you?
good, fine. From where you are coming?
I'm coming from the States. I'm a
Okay.
resident in the US.
Okay. So being practicing medicine, you know very much so many things about the lipoma. I think your knowledge will be more than me in this. I get, and it's not that. I get patients sometimes they say, sir, we have done PhD in lipoma, 10 years of study, 12 years of study, and then they finally come to me, then they finally realize now we have to remove them.
Yeah, so in the past I've had some removed. They've always been benign. They're just fatty tumors. You know, you can see some surgeons have made incisions over the many years. I've removed maybe 10 to 15 with some very nasty scarring. So I did some research online and I found that Dr. Bonot was, exceptional in minimally invasive lipoma removal and, no scarring. And my problem is scarring.
Yes,
So
I can see these type of scars. If somebody is getting because of this lipoma, nobody would prefer to get them removed rather than he will be happy having that bumpy skin.
So it's hard to wear short sleeves and
I understand this is more of psychosocial disease.
yes, very emotional.
And it's sometimes it's painful also. How
Very
are the
painful.
lipomas for you? They are
I would
painful?
say 50 to 60% are painful.
60% are painful.
Yeah.
Then that is another indication for removal. Otherwise, sometimes I say if they are there and if they are not looking grossly, they are not deforming, and they are not psychologically bothering them, no need to remove unless any of them starts growing fast. What else you tried for these? If these are the removals, you have tried any other medication like homeopathic, Ayurvedic? Because in allopathy we don't have any medicine for this. So what you have? Is there any scope of this type of medicine in US?
Nothing other than surgical incision, and some people recommend injection, which is called fat lipolysis, which will break up the fatty tumor, but that doesn't work.
Lipolytic injection is also recommended, and I had a patient from Europe, UK I think, and he had done this lipolytic injections. So many, almost one lipolytic injection he had for one lipoma he had spent 500 euros, and that is just for one time. You can understand how much will be the cost for these lipomas, and even if it is helpful and you have money, I understand maybe you should, but if it is not working, then it's a trauma also. And another problem was when he took that injection, it initiated some inflammation in that area, and then removal was even more difficult.
More fibrotic.
Yeah, they became more fibrotic, and they become painful also after that. Then they injected steroid. You tried steroid also?
Yes, steroids after that. Yes.
Yeah, steroids
did nothing.
Steroids don't do anything. They will not initiate inflammation also, but they can cause infection. If the infection comes, then it will be inflamed. So that can be another problem. So I do not recommend it at all. And what you say, it's you being a doctor, you can also guide us.
Yeah. The only way to remove these is through an incision. And the way that we did it in the past is it's the scarring that's the problem. So that's why I found you, and with the minimal invasive technique we can remove the entire lipoma with the the capsule. So that's the best bet.
Okay. So traveling from New York, coming all the way to India, what are the hitches?
It's just a long flight,
Just a long flight. By being a doctor, you understand everything, and expensive also. But for people travel like US, I get so many patients from US, Canada, and Australia, different countries. Well, that flight, and that's okay. But another is your psychological this thing. You are traveling to a different country.
It's scary.
Getting your treatment and surgery, and being a doctor, you are coming from the most advanced country. And I think the New York, sometimes I get from Singapore also. So these are the places which are the medical hub.
So this procedure is not available anywhere else that I'm aware of. I mean, in terms of in the States. So coming here was my only option. It was scary, and then you have to apply for a visa, and that's a whole nother process. But once that goes through, Dr. Bonot makes it very easy. His team is great. They mark everything. They discuss everything with you. They're always messaging you. Very professional.
So, just want to add, multiple lipoma is not a disease. It's just a condition where you are getting it genetically, You can just take it like a little bit shape changes in your body. If you are comfortable with that, it's okay. But if these lipomas are painful, definitely we will remove. Especially for him, the concern is pain, and second thing is psychosocial is also there, because whenever you are wearing half sleeves or something and these become visible, if even if you are not conscious, people will make you conscious. That's the biggest thing, and then you get little demotivated. Or it's a common feeling anyone will have if people keep on talking like this. And it's not a disease, it's not communicable. If I touch him, if I touch it, it will never spread to me. It's more of a genetic condition for him. It's in his mother had 7, 8, and maybe in the family another siblings may have 1 or 2, but it's not necessary you will have your siblings also have.
No.
That's what
that I'm aware of.
Yeah, that's what I say.
Yeah.
Even many times I get brother sister is having nothing and sister is having so many. Sometimes out of 5, 4 brothers, only one of them is having this. So you need not think that this will pass to your family. If it has to come, it can come anywhere. I get so many patients who had no history, but somehow maybe that was missed. One lipoma was there in the grandparents, and it had come. So primarily it is a genetic thing. But if you are finding you are not able to correlate, not able to find, don't be bothered about it. You can't do anything about it. Whatever are the lipoma, removal is the treatment, and chances of going to your children is very less. So don't be worried about that. I get a patient who was not getting married because of this. That my children may get or not, and this should not be a concern. Normally, medicine do not work on this. Injection lipolysis, I have already told, because the vascularity is not high in this. Fat cells, when the medicine is injected, it's not reaching anywhere. It's just killing that local 1 or 2 cells, and it's not going to help. That's the one thing. And as such, sometimes it causes a severe scarring and fibrosis, that then the removal process also becomes difficult. So chances of recurrence is negligible. Out of hundreds of lipoma, maybe 2, 3 may come, but normally what happens is there are some of the lipomas are in very small size at present, maybe 3 mm, 2 mm, like one lipoma. Just I was touching and found this was so small. And gradually, right now we are not noticing, maybe after 3 years you will notice. So you cannot correlate that I have removed this and because of this it has come. It is not that. Whatever we have removed, it is over. Thank you. Anything you would like to add?
No, that's it. I'm just looking forward to the end of this. I'm very excited.
Perfect. You will be perfect, and I will try to make sure that you get more than what you thought.
I appreciate it. Thank you very much.